Okay, you're good to go.
Okay. Hello, everybody. Today is Thursday, July 23rd. It is 1:30 p.m. and we are all meeting for a regularly scheduled Las Cruces Economic Recovery Ad Hoc Board meeting. I'm going to officially call this meeting to order. And the first thing on the agenda is going to be a conflict of interest. If there are any conflict of interest, if you will please raise your hand and we will address those at this time. As seeing there are none, we will go ahead and move on to the acceptance of the agenda as presented.
I'll move to accept the agenda. This is Michael
Mr. Harris has moved to accept the agenda as presented. Do I hear a second?
George Miller, second.
Thank you, Mr. Miller. So I have a motion and a second on the floor to accept the agenda as presented. Any discussion on the agenda as presented currently? As hearing none, Mr. Francisco, can I get a roll call vote, please, on the acceptance of the agenda?
Yes, Mr. Chair, this is on the acceptance of the agenda as presented. Mr. Michael Harris,
Yes.
Mr. George Miller,
Yes.
Ms. Sharon Thomas. She's absent. Ms. Brooke Montgomery,
Yay.
Ms. Veronica Archuleta,
Yes.
Mr. Ron Fitzherbert, Mr. Ron Fitzherbert. It's absent. Mr. Doug Cowan,
Yes.
Ms. Susan Greenwald,
Yes.
Ms. Jolene Martinez, Ms. Jolene Martinez. She's absent. Ms. Arlene Lopez, Ms. Arlene Lopez, currently absent. Ms. Debbie Moore,
Yes.
Mr. Chair,
Yes.
motion passes.
With that being said, Francisco, do we have quorum at this moment? Oh,
Yes, Mr. Chair, we do.
Okay, perfect. Thank you. Ms.
Yes, yes, we
Lopez
do.
just logged in. Perfect. Okay. So we will be working off the agenda as presented. Motion does pass. Approval of the minutes from the July 19th meeting that were out. Anyone has any changes, we could entertain that now. If not, I would accept a motion to accept.
This is Michael Harris. I'll motion to accept the minutes.
Debbie Moore, I'll
Okay,
second.
So we have a motion and a second on the floor to accept the minutes from the July 9th meeting. Any discussion on those minutes? As seeing none, Mr. Francisco, can we please get a roll call vote on the acceptance of the minutes from the meeting on the 9th?
Thank you, Mr. Chair. This is on the approval of the minutes of the meeting on the 9th of July 9th. Mr. Michael Harris,
Yes.
Mr. George Miller,
Yes.
Ms. Sharon Thomas, absent. Ms. Brooke Montgomery,
Yes.
Ms. Veronica Archuleta,
Yes.
Mr. Ron Fitzherbert, Mr. Ron Fitzherbert is absent. Mr. Doug Cowan,
Yes.
Ms. Susan Greenwald,
Abstain?
Ms. Jolene Martinez. She's absent. Ms. Arlene Lopez,
Yes?
Ms. Debbie Moore,
Yes.
Mr. Chair.
Yes.
Motion passes.
Thank you. Okay, first on our discussion, we have two discussion items. One is going to be a presentation, well, a video that we will be watching on COVID-19, a public health update that we will be watching and reviewing, and that I think is a 15-minute video that we'll be watching, which is good since we are under tight guidelines that we have to be ending by 3. So if we can go ahead and start on that video.
Excellent, Mr. Chair. Thank you so much. We reached out to several people trying to see whether we could have some updates on health. We did attend a meeting in which I think it's very, very helpful for some of the information that is going to be presented. This presentation is by Mr. Dan Schlegel with the Office of the Governor, and he presented this data with a group in the tourism sector. So I think there's a lot of relevant data for the businesses in Las Cruces that will be presented now. And this meeting happened exactly 1 week ago. It happened on the 7th, I think it was on the 16th, if I'm not mistaken. So the video, I'll start streaming it right now. Please let me know if you can hear it.
All right, thank you, Susie. Apologies for the delay, everyone.
Is everyone able to hear it?
Yes, sir.
Excellent, thank you.
I have a couple of slides here that are really about the public health data and the gating criteria. I won't spend too much time on it, but I wanted to kind of give you all a sense of what the public health officials and what the governor sees in order to make some decisions about the reopening phasing. We go into the next slide, Susie. So this is a 7-day rolling average of the case positive counts. So you'll see that we have gone up pretty dramatically in the past month or so. Unfortunately, we want this number to go down, obviously. There is a blip around end of May, early June. That was mostly due to Otero County detention facilities. So it was kind of a contained area, still disconcerting, but it wasn't as alarming to the public health officials as what's happening now, where it's pretty much, collectively coming from all over the state as far as the positivity cases. So as you can see, we're at pretty much our highest, very much our highest 7-day rolling average of positive cases since the beginning of the pandemic, even back from the when things were going very bad in the Northwest. Go ahead and next slide, Susie. And then this is what would they call the rate of spread. So it's basically, for every one person who gets it, how many other people are going to get it. And you'll see some markers here that show some of the actions we've taken with the public health orders and how there is some correlation here. So oftentimes, there's a good 3 weeks lag at least for us to see trends in the data shift from actions that we take in the public health order. So the last major one that we took, besides the most recent public health order, was that June 1st when we reopened dine-in restaurants and gyms and salons, and among other things. So we see about 3 weeks later, we see things really start to kick up and have been steady since then as far as the rate of spread. Next slide, Susie. So this is a map of states that are considered where they're at in their reopening and if they should or should not reopen. So this was a collective of epidemiologists who started putting together data based on gating criteria and recommendations for if states are ready to reopen or not. So this was 6 weeks ago. We were one of a handful of states that were doing pretty well. And so this is around the time when we decided to move forward with phase 1B, which was the indoor dining, among other things. Next slide, Susie. And this is today. Same map. They've these group of epidemiologists have added a fourth category of on the bottom left, uncontrolled spread. They called it bruised red. This is, you know, the position you do not want to be in as a state, and this is where some of our neighbors are at right now, where there's uncontrolled spread, and we have dropped into the trending poorly category, unfortunately. Next slide, Susie. So as far as an approach to reopening, you know, early on, the White House put out recommendations for gating criteria based on hospitalizations and number of cases and the rate of spread and stuff like that. And like many other states, we set our own gating criteria based on this guidance. Next slide, Susie. And this is our gating criteria, and this is as of yesterday. So you'll see in the far right column, that's where we're at. In the red, if it's red, that means we're not meeting the gating criteria. Green means we are. So we've, our rate of spread is 1.08, which has actually gone down quite a bit from recent days and last week in particular. So that's positive. So hopefully that's a trend that continues. The testing volumes, we've been consistently testing quite a few people. Our gating criteria is at 5,000 a day, and we've been well over that, which has been good. And then contact tracing is somewhere we've had some major challenges, and with the rising case count, which has been, you know, getting into the 300s lately, this is where we've seen some challenges from the state level as a response. We have hired a lot more contact tracers, so hopefully that number will get under control soon. And then the last one is really about hospital capacity. So we're looking at, you know, number of ICU beds. We're doing well there, but we do have projections that, you know, if we're on our path right now, as case counts have been going up, hospitalizations are starting to, they lag behind about 14 days from the case count going up, but we're starting to see it creep up again now. Next slide. So this is just a quick snapshot of a framework for assessing risk. This is based off of a model from Johns Hopkins University that talked about, you see on the bottom here, it's a contact intensity. And then on the y-axis, it's number of contacts. So the further you get up towards the top right is higher risk. And so this is kind of how we've done our best to use this sort of framework to determine how we do the phased reopening. So we open lower risk things first for the most part, trying to move forward across this axis. Next slide. So this is a snapshot of the reopening, what we've done in the past and where we're at now. I won't spend too much time on this, but you'll see on the top right, what's now known as modified 1B in our inner circle is where we're at now. So we made the change to restrict indoor dining for various reasons that I can go into if there's questions about that, and also gyms dropped down to 25%. So that was the main change, and also, of course, on July 1, which is not listed here, there was or which I guess is noted down at the bottom, is the travel order was tightened up, and then well as mask enforcement. Susie, I'm going to stop there and just open it up for any questions. I know you're all interested about how decisions are made, so I'd be happy to talk about that and role of the Economic Recovery Council as well, which does takes into account scenarios that come to our attention about equitable opening and parts of the economy that might not be categorized, these broad categories that we have in the public health order. So we take a look at those as well and make recommendations to the governor.
We do have one question here, Dan. Why didn't they shift to 25% on indoor dining as they did with gyms?
That's a great question. So we, another data point that we've been working with, or another program that's going on since May, has been what we call rapid response. And so this is through the Department of Health and really the OSHA, the Occupational Safety, Health and Safety Program through the New Mexico Environment Department. So a rapid response is when we learn that there's an employee that has contracted COVID. So this is usually known to us through our contact tracing. Sometimes an employer might let us know themselves, but oftentimes it's just somebody tests positive. We know where they work, so we work with their employer to do a rapid response to their workplace in case anybody else has been in close contact with that employee. And it doesn't necessarily mean the employee caught it, at the facility, at their employer's facility, but it is we do rapid response so that they don't spread it to other parts of the employment. So the food industries, since we've been doing this in May, the food industries have been the highest percentage, or one of the highest percentages, right behind the healthcare facilities. But restaurants make up a disproportionate amount of that. So to date, they've been about 14% of those rapid responses. And that's even higher than hospitals, which is pretty shocking. So that's one indicator to us, a very strong indicator that restaurants do have a higher risk. And a big part of that is, not all that surprising. It was the last segment of the economy that we're allowing to open that was indoor, and where people weren't wearing masks. They can't because they're eating and drinking. So that was, it's not a huge surprise considering some of the other science we know about mask wearing in indoor spaces. So that's the main reason for that. And gyms surprisingly has a very low rapid response rate to date for us. So we're still watching that. So that's the main reason for that.
We have some other questions about clarification on criteria for moving into future phases, but I don't want to get ahead of you, Dan. So do you want to continue, or would you like to go ahead and take these questions?
No, I'll go ahead and take the questions. I don't think I had a couple of other slides, but this was modified from a previous presentation. So I think I'm going to stop where I'm at here on the presentation goes. But sure. I will say that, we're still using the gating criteria. So if we want to go back a few slides to that one, we could take a look at that as well, this one here. So as we meet these requirements for the gating criteria, that will be indicators for moving into the next phasing. And I think there is, as I showed on the first slide, that there's our 7-day rolling average of cases is skyrocketed. And it's the highest it's ever been by far during the pandemic. That is another point that a lot of people are worried about in the public health side, that the rate of this rate of transmission, this first gating criteria, can level out even though the cases are still very high. So that is a concern to them. So they're taking that into account as well. So they're looking at growth rates of the positive cases as another measure. But in general, we stick to the gating criteria, and if we can get below that and stay below that for any meaningful period of time, then we consider going into the next phases. But I think right now, our state has been very methodical in how we move forward, and we've learned from other states who opened up before us that it really takes, it takes at least 3 weeks to really see any kind of change. And then to really see something kind of explode like it has in Texas and Arizona, it takes like 6 weeks or so. So, they opened up indoor dining and bars well ahead of us. And, they've seen those consequences come, a good more over a month later. So I would say that, we're watching the gating criteria and doing everything we can to, enforce mask wearing and to decrease spread. And as we see that come down, then we'll look into reopening more parts of the economy. And I will add one more point that the governor, is really focused on reopening schools as soon as possible. So that's another major consideration in all of this, where that's a priority for reopening. So we want to make sure that we don't jeopardize that as much as possible.
Mr. Chair, that's the part of the 15-minute presentation that was showing the data. The video continues to move ahead with some information for some questions, but that's the presentation that shows the gating criteria. It shows 7 days ago where we were, where the state was, and it was also showing some of the trends for some of the health data. Thank you, Mr. Chair.
Thank you for that information. I appreciate it. Okay. So that was kind of the health presentation that from last week that was presented, that went over the numbers. I am not a numbers expert on that presentation. I don't know how many questions we can actually field with that, but if anyone has any comments or anything like that on that presentation, if you want to raise your hand and we can from there. Francisco, do you have your hand raised?
Yes, I just have one quick comment, Mr. Chair. Tomorrow there's going to be a special city council meeting in which there's also going to be some health officials that will be able to relate some further questions. Well, not further questions, but some further comments with regards to that. So if members of the board are still interested, we highly encourage you to log into YouTube and stream the video so that you can see some of the questions that they're going to get asked. And I presume, knowing our counselors, that they will be requesting information specific to Doña Ana County. So some specific information related to Doña Ana County, I think they're probably going to cover it in tomorrow's special council meeting. If you cannot stream it live, it's YouTube. You can always go back and listen to the presentation whenever you get a chance. I just wanted to point that out, Mr. Chair.
Wonderful, thank you. And then can I actually get co-host access so I can start unraising people's hands and such, please? Mr. Cohen, you had your hand raised next.
Yeah, thank you. I would have liked to have seen, they showed a chart. The very first chart, they showed the number of positives. I would have liked to have seen an overlay of how many tests, so that we could have seen a comparison of number of tests and then the number of positives on that chart. That would be very helpful, and it would certainly be nice to be able to get that. And perhaps I don't know if we can request some of these questions that we're going to have to be answered tomorrow or not. It would certainly be a wonderful thing. Also, I noticed on the second slide, the rate of spread seemed to actually have a slight downturn, and there was not a spike. It was a slight downturn. And then also a third question I have, and I certainly would love to see this question answered on the gating criteria. They're talking about hospitalizations, and we know for certain that the governor has allowed some neighboring states to have some of their patients come over here to be admitted into our hospitals. I know that for certain. I'm wondering how many of those that are in our hospital are not actually from New Mexico, but they're transferred patients that's affecting our data on that gating information.
Thank you for those. Francisco and or Ms. Martinez. So are those questions that we can get answers to, or should we be emailing our city councilors and our mayor, since they're going to be having this presentation tomorrow, so that they can ask those questions and we can field the answers from them? How does that look, since this was a video presentation to us and not an actual presentation by the state?
Mr. Chair, with the challenges of technology, the venue to provide public input, including questions, would be to email City Council and Mayor. So, Mr. Cohen, my recommendation would be to capture those questions and send those to the Mayor. During the sessions, he goes through the public input and he sorts by topic. So if it's something specific to this topic, he would read those during that presentation. Thank you, Mr. Chair.
Thank you for that. So I think that's what we can do, is we can all probably just reach out to our counselors and our mayor and let them know that we did see this video and this video was presented to us. And if we have any questions about more information, they can relay those and get those to us. Probably a lot easier than we could with the state right now. Mr. Harris, you had your hand up next, sir.
Yeah, so I was wondering if it would be possible, if that video that we saw, I assume that it was from some public meeting, and if we could get like a link to it sent out to the group or added to the minutes of this meeting for the record, that would be quite helpful, so that, you know, us or members of the public who want to see the whole thing could get the whole thing.
Yes, I think we can do that. And I think it's from the last city council meeting on Monday. So it was presented. I think that's where we got this presentation from. Ms. Martinez?
Mr. Chair, you are correct. And we can also include the link in the minutes as well. Thank you for that recommendation. Thank you.
Mr. Chair, just as a point of clarification, and this was not presented to City Council, this was to the New Mexico Tourism Department Task Force.
Wonderful, thank you. Ms. Debbie Moore.
Yes, Mr. Chair, I just pulled up the information. Mr. Cowan, there has been 44,404 tests in Doñana County as of yesterday, and that is on the NMH modeling. If you go to NMH and our dashboard, I can get that link, so send out the committee. We've had 1,838 cases, 14 deaths, and 684 recovered. That is up 332, I believe 332. Yes, 332 yesterday. So it will be updated real quickly for that. So that's test performance, and that's Doñana County. And I will say, Mr. Chair and Mr. Cohen, one of the things we've been is that rate of spread is that we've wanted and asked it for some time. So I'm hoping the city councilors will be able to get it, because I've asked several times is to get it just for Doñana County. That rate of spread is actually for the Southwest. Hope that helps.
Thank you. I appreciate that. Is there any other questions, comments, or concerns on the presentation, or any questions that you think needs to be brought to the city council that they can ask? If you want to share those, and then we can go forth with that. Mr. Harris.
Sure, I guess a general comment, and I'm sure they'll talk about this tomorrow at the council meeting too, but as far as like the hospitalizations go, I agree, it would be interesting for us to find out how many are from out of state, like actual numbers. But also, I mean, as a general comment, it doesn't actually matter for our gating criteria. Hospital beds are hospital beds, and it doesn't matter who's occupying them. They're either available or not. So that is an unfortunate thing about this. So anyway, that's all I think for this subject.
Thank you for that comment. And then also, I think something that's really interesting, just because we are all we are living this COVID information life, and something that might be really interesting to see is how many of these tests are actually individualized tests, where one individual is being tested, because technically per guidelines to be released back to work, if you did test positive, would be to get 2 consecutive tests because of the fail rate. So I wonder how many of these tests that are being taken in Doniana are actually second tests to a original, or, you know, some people are taking 3 tests, 1 is positive, the second is positive, and then the third finally comes back negative, where in that case they work and they're able to start coming back into the workforce and stop quarantining. So I kind of get where these numbers, so I'm wondering how many are actually individualized per person and how many are multiple by an individual. So I think that would be a good question that I'll email out as well. Mr. Cohen.
Yeah, I'd just like to clarify, I think it does matter on that gating information, because they're basing business closures and the ability to reopen, and our job, or our task here, is to help our economy recover. And so if we've got foul data, or we've got information that they're using to hinder businesses from being able to open, we need to make sure that we understand that data. And so it does very much matter who's in those hospital beds, because that gating data is assuming that it's New Mexicans that are filling those hospital beds, and hence that's why there's policies hindering New Mexican businesses from being able to go forward. So I think it's very, very important, and I'm very disappointed we can't get some of these questions sent directly over to the city council as our committee. If we could put these together and have city council address these questions, because if all of us send questions over, they're only going to pick a few of our questions. They're not going to answer them all or ask them all. And that's one of the negatives about this technology, is we send over these emails, but there's a selection process. And so not all of our questions get answered or asked.
Okay, thank you for that. And I have no issue with emailing. If you want to email city staff, either Francisco or Griselda or Cynthia, your questions, and they can get them to me, and I can populate an email and get it over to the council as a economic recovery ad hoc board questions that we would like answered when looking at this data. I have no issue with that. So if you want to direct your questions to them and they can get them to me as a proper go through, we can get those off to city council and mayor. I think that's a great idea. I have no issues with that. Any other questions related to the presentation and or thoughts or comments? Mr. Francisco.
Mr. Chair, just as a reminder that the meeting is tomorrow. So if you want to send these questions today, so that we can compile them and send them to you, Mr. Chair, so that you can provide them and relate them for the city manager to provide for the councilors as questions they can ask.
Okay, so with that being said, it's 2 o'clock now. We will be off this meeting by 3. So let's go ahead and get those questions to me by 4 o'clock, and that way I can get them off at 4 o'clock to city council by end of day 5, and that way they can review and do all that good stuff. So 4 o'clock, guys, if you can get those questions to me and I can get those over by 5, that would be great. Ms. Sharon Thomas.
I just want to remind everybody that the meeting tomorrow is at 9 o'clock. It's not the usual 1 o'clock city council meeting time.
Thank you for that clarification. Any other comments, questions, concerns? Seeing none. Also, with the meeting tomorrow, they will be the Economic Development Department will be presenting the Mexico Safe Promise, or the Las Cruces Safe Promise, to City Council. Debbie Moore and myself will be there to field questions on that. Anything that the city staff has not able to answer. Debbie, as well as myself, I have another meeting as well that day that I will be on, but we will be fielding questions as well for them. But so if you can tune in to see what goes on with that, please do. Moving on, we did have a presentation last week from Workforce Solutions where Ms. Lopez, who's now a member of our board, welcome, gave us a presentation. And we are a board that is looking for things that we can suggest to the city council to do to help revive and reopen the economy here in Las Cruces. So one of the discussion items that we had was any possible action items from Workforce Solutions that we can go forward with. So let's go ahead and open up that discussion and start talking about things that would work. Ms. Lopez, I don't know if you had a chance to brainstorm over the last week to see if there was anything, or the last 2 weeks, to see if there was anything really that kind of fit the bill that we can get behind and really help drive with the city council. Ms. Lopez, are you with us?
Hi, sorry.
You're fine, no worries.
I came outside with the kiddos for a second. Yes, so the thing that I wanted to, I guess, propose is I had a discussion with the board administrator. And so the thing that I think would be the most easy and beneficial for the system that the city could do is perhaps set up something to the effect of a scholarship where we have a gap, because we really do have a wide range of people that can be eligible, because we do, you know, disabilities, Native American, low income. We have so many categories that WIOA, the Workforce Innovation Opportunity Act, can cover. So a lot of people do find themselves eligible, but it has happened, and I've had it happen in the last couple of weeks. And like I mentioned during our last meeting, a lot of that has been with the alternative licensure program because of federal funding conflicts. So where that could come into play is, let's say I have a person at my desk, and you know, we've gone through this eligibility, and then we determine, you know what, the school you want to work at actually already has Title I dollars, so we cannot fund you there. But what we can do is we can roll you over into this scholarship that the city has and see if you're eligible. And so what we would then do is develop a spreadsheet, or maybe even just a quick form like on FormStack, where we could determine what the eligibility requirements the city would want to see for that is. I would think the first eligibility would be, have you applied for FAFSA? Have you applied for Title I WIOA funds? Making sure that they've exhausted other resources first. And then of course, you know, we want to get some demographic information for the point of reporting, but ultimately, you know, let's try to refrain as much as possible from eliminating anybody, from using any kind of like income eligibility, because that's another area that I saw. I had a woman that, I mean, my heart was broken for this lady because, you know, she wanted to go back to school. She's been a housewife forever. And yes, her husband made a decent income, but that's not her income. She wanted to be self-sustaining. She wanted a career for herself. She wanted to show her daughters, you know, it's never too late to do this. And it was very heartbreaking for her to realize that she wasn't going to be eligible for FAFSA. We couldn't help her because of the income. And really, there was just no more options for her. So, you know, I would like to see a very loose eligibility. And since it's not federal, it should be easier for the city than I think it would be for us. So the way that would work, because I actually, godsend, I had a lady that I met with that I was introduced by Tracy with the bridge of Southern New Mexico. This lady comes to us from Minnesota, tons of workforce experience, and she just wants to volunteer. She's not even looking for a job, but she's got all this experience working with individuals of low income, working with women, getting them career development and all this stuff. And it's just perfect. And what I've talked to her about is potentially being that liaison or maybe a subject matter expert that could help between the city and workforce, that she would be supporting the city, whoever is involved in understanding what we need to do on both sides, and then help the workforce partners if they have questions, because she's going to be here from the beginning. So she's going to watch this thing build and morph and be very intuitive on how we can work it out. And so, you know, I think she would plug in really good right here. And so we already have somebody in mind that can help us execute this. So, you know, that's my proposal, is that we keep it separate technically, because then we are not responsible. Because, like, for instance, WIOA, because it's federal dollars, if we were to say we want to help people of color, that would be considered discrimination, because we'd be eliminating certain people from services, and we can't do that. We can't do gender. We can't do anything that falls in the Discrimination Act. So even though we're helping a certain population, we're eliminating another. So that's where we get stuck. But a local program with different types of funding does have the ability to say, we want to help single parents. We want to help people, you know, Latinos, entrepreneurs, whatever it is. So that's another thing that we can look at, you know, if the city was willing to entertain something like this. And then the way we can do it, it's an option. I don't know how the city does this, but an option would be that we just, when we get an applicant, somebody who didn't qualify for everything else, and we have them fill out that form, we bring it back to the board and we decide as a group if we should fund them partially, if we should fund them fully for the semester, and you know, if it's agreeable, whatever their plan is, whatever their career plans are, and then we just make a decision as a group whether to approve or deny someone's application for that scholarship. And it would be by term, so we wouldn't be like funding someone's entire you know, their entire degree, you know, say they were going for a bachelor's or whatever. We would just be going by term. So hey, if you want to go back to school next term, you got to try again. Apply for FAFSA, go to WIOA, we're last resort. So that's my proposal. And then the next step is if that's agreeable and we want to kind of move forward and see what we need to work out moving forward to get this actualized, I would need to have the key players from this group meet with the administrator from my board, because of course, if our name's on it and we're supporting it, I gotta have the board's approval. They're all about it though. They love this. They love the idea of this partnership. They love that the city is so willing, like this is so awesome. And who doesn't want to help these individuals that have been most highly impacted by COVID? So that's my proposal. Next step would be to meet with the administrator and make sure we cross all the T's and dot all the I's. Sorry, I think you're on mute. Either you're on mute or my thing is doing something goofy.
No, I was on mute. Thank you for this.
Oh.
Great idea. It was very interesting. We do have a couple hands raised. I'm gonna go with Griselda first. Ms. Martinez.
Mr. Chair, Ms. Lopez, thank you very much for that recommendation. I think the conversations that we've been having, this is a very actionable item. My question is specific to funding. What would be a figure that you would see as impactful and beneficial for the volume of the type of assistance that you are seeing through your office?
I think, you know, an average, I mean, I would love to get you some better specifics. So I can get a report from our providers to make sure that we have actual numbers, like what are we typically assisting individuals with each term. Now, it's going to vary so hugely because we help people with certifications for technical skills. So of course, those short-term skills tend to be a lot cheaper, but then they also have supplies that we include in their tuition. So if it's welding, you know, we want to make sure that they have their protective gear. We want to make sure they have whatever it is that they need to do that, their tools. So we wrap that up in tuition costs. You know, so some fields are going to require more supplies and things like that than others. So, you know, so it's going to depend on that. It's going to depend on if the individual is going full time or they're going part time. So it's going to vary. So that's why I thought, you know, like my mind is thinking like an entity that for instance, I don't know if you guys have ever heard of Hands for Hope. It's an organization that helps families with children that are ill, terminally ill. And the way they worked it out is kind of the way I have it in my head. So basically, somebody comes to them and says, hey, this is our situation, we could use some help. And then they go, basically they take as much information as they can from that candidate, and then they schedule a board meeting. And then they all get to review this person's information, their background, what they need, and what the total cost is. And then make a determination if, hey, you know what, this person is really, really at the high end or at the low end of the income range. They have all these barriers, and their total cost for the semester is going to be $3,000, including books and supplies. We want to go ahead and cover it entirely for the semester. Or it may be somebody who's at the higher end of that income bracket, and although they do still need some assistance, we may say, you know what, let's just approve the tuition itself. You've got to get your own books, get your own supplies, but we'll pay for your tuition. So I'm thinking that it's going to be case by case. It really will be up to the board to decide who they fund and how much.
Ms. Debbie Moore.
Yes, thanks, Darlene, for that. I do have a couple of questions. What is the accountability if we, for example, provide scholarships for a welder to be, future welder be certified? How can we guarantee that they go through the program, and what is your standards of accountability through that, so we know that the money, taxpayers' money being utilized through the city is actually putting someone to work?
Well, as you can imagine, being that we're federally funded, we definitely got to meet those metrics. So what we would do is we would work out, probably would need to do an MOU, an official MOU between the board and the city, so that we would be able to exchange that PII. And then that way we would have open lines of communication and be able to share with you their first quarter, second quarter, third quarter, fourth quarter employment information. So we follow them for a whole year after they get their certification or their degree. So you would be able to see, are they employed in the first quarter? Are they employed in the second quarter? Are they employed in the third quarter? Are they employed in the fourth quarter? And then obviously we, as they're working through their program, they have a case manager that's constantly following up with them and making sure they don't need anything. So in addition to the money you provide, we may still even be able to do supportive services, even though we can't pay for the tuition. So we might be able to still support them with childcare, transportation, other things like that. So that case management, it goes beyond just the training. It's, hey, has a new barrier come up that may prevent you from completion. So we definitely do follow back up at the end about the credential with the school. So we get the transcripts and we add that into the system, and then we follow them for a year for the employment.
So, Mr. Chair, Ms. Lopez, then do I assume that this would be open to someone who wanted to increase their skill sets as well as someone? Or are we talking people who are totally out of a job right now? I mean, how, and then my question would be for Ms. Martinez or Mr. Paredes, does the anti-donation do that kick in here? I mean, it's a great opportunity. I just want to make sure. I don't believe we as a board could be responsible for distribution of the money. I believe it would have to go through city council, and they would have to appoint another management. We could certainly start this in motion, but I'm just a little concerned about who would manage it, who would ultimately, but I want to make certain that it might be for some train up as well as people who are actually looking for a job as well. And then the other piece of this that's missing is you're talking about the worker, and sometimes I'm talking about how to start a business entrepreneur, which that would be, how do we make this fun if it would be the ability, Ms. Martinez could answer that one. So I'm just kind of look at those, several of those pieces.
And I think, you bring up some great points, and those are the very people that I would love to see the city complement us, because those are the people that sometimes do fall through the cracks, the entrepreneurs. These are individuals that are incumbent workers. And even though we do offer incumbent worker training, it can become a little more tricky. And so that would be where the city would be able to step in and say, you know what, we're going to lower the bar a little bit. and say, you know what, yeah, this individual's already working, they already have a decent job, but we're still gonna help them. We don't care what their income level is. If you know, of course, not if they're making like $1 million. I think we save our money for someone more in need, but you know, we have a little lower bar, you know, that would allow for us to be able to support more people. So I think that, you know, it really would then, that eligibility would be up to the city and for the board to recommend, you know, hey, we want to be able to help people. That's why I think it will be more of a case by case. So we may have to have like a subcommittee that meets just for the approvals. So that way we can look at the whole thing and from top to bottom and then make an educated decision on who to fund.
So, Mr. Chair, Ms. Lopez, I don't believe we legally can be the board that distributes the funds. Yeah, and so we would have to give the recommendation to the city council. I will say, Mr. Chair, that I think in addition to this as an actual item, I think I've looked at several other cities across the nation and their recovery funds. One of the things they've looked at, and Mr. Cowan has mentioned on several occasions, about how to help businesses, is to look at the fee structure, look at things that are being paid. How can we work with the city to either, you know, delay implementation, or you know, somehow how we can physically help them in ways that wouldn't be necessarily, when I say cash out of the city, there's going to be cash because you wouldn't be income. But I think there's some very creative and innovative ways we can help them, this being one part of it. But I just want the board, unless I'm just really off base, we as a Las Cruces Economic Recovery Board, we are ad hoc. And so I think it would have to be an MOU between the workforce and the city, but we wouldn't be the ones to make the decision. It would be the city council. With that, that's my comments. Thank you.
Ms. Martinez.
Mr. Chair, Ms. Lopez and Ms. Moore, yes, you are correct, Ms. Moore. The recommendation, if the board chooses to make this actionable item and recommendation for city council, it will have to come to them for adoption and for then staff to implement. And so for us to do a partnership of this sort, it would be relatively easy because Workforce Connections it's another governmental entity. And so as long as we do not limit, similar to what Ms. Lopez mentioned, that if we specify certain people cannot access, that's not allowable. As long as it is open to anyone seeking the services, we would be okay. We can verify it with our legal department, but it would be in the form of an MOU. And the MOU, we could have deliverables, and we could definitely partner on defining that criteria and making sure that those benefits are actually realized. So that would be the process that we would need to follow shall the board decide to make this recommendation. On the second item that Ms. Moore brought for discussion, that may be an interesting topic for future discussion, and we could invite the Director for Community Development, who is the department that is in charge of those items as well. Mr. Chair. You're muted, Mr. Chair.
Thank you for those clarifications. Mr. Harris, you do have your hand raised, sir.
Yeah, thanks for all those suggestions. I would also be curious to know what the estimated impact of like the scholarship fund would be in terms of how many more people how many people who like don't have jobs today would be able to get them, you know, what the rough ROI would be on the amount of funding that would need to be put forth, just so that, you know, if we included in our proposal to the city, it would be useful to know these things. Because they do have limited resources, and, you know, we would need to justify stuff like this. So I think if we do carry this forward as a discussion item and ultimately propose it, that we should include some of those numbers.
Yes, I think that, you know, as we draw closer, I can definitely, you know, I can pull some reports to maybe identify, you know, if the programs can give me a list of like, these are the number of people that came to us and we weren't able to serve. You know, that would give us some indication of the number of people that we would be able to assist. But the reality of it is, you know, we wouldn't be able to give a really accurate estimation on that return on investment without knowing how much the investment is, you know, and how much money there will be to utilize. Because of course, you know, the more resources are, the farther it can be stretched. And I think that, you know, if we move beyond just looking at who fell through the gaps with WIOA and actually target an initiative, we want to make sure we have the ability to do that, first of all. And then secondly, you know, if there is enough funding that we could actually, you know, in combination with us, you know, just supporting those that fell through the cracks over here with workforce, actually making an intentional effort to find those individuals that tried and were not successful in getting assistance and going back to school, or getting training or getting on the job training, so that they could find themselves in a higher paying job. So, you know, those are kind of the variables that I see right now.
Yeah, so I guess a question that was asked, which I did not catch the answer to, so forgive me if I missed it. But I think we would need to know what amount of money would be impactful. So, you know, we don't really know how many people there are, how much money it takes to serve a person. And, you know, we can't just go to the city and say, hey, can we suggest you give $200,000 to this program per year or something.
Okay.
So
what I can do is I can pull reports from our adult and dislocated worker provider, so that we can get a good idea of what the average amount of dollars they're spending on each participant in assisting them in their education per semester, as well as hopefully we can find you know, the number of individuals that fell through the gaps. But at least if we can see how much they're spending per person on average, and kind of use some of the metrics that they're using, it'll give us some idea of the impact that we could have and what we would need to make that impact. So I can do that.
Yeah, that would be helpful. Thanks.
Okay, so just really quick, a clarifying question, and maybe this needs to go to staff. So I don't actually know if we can put a dollar number behind an ask with the city council. I think that would probably have to go through economic development and the community development side, and they would probably have to work with workforce to figure out what that number is. I don't actually know if we're allowed to give us a $500,000 for a 4-year commitment type thing. Griselda, do you know if that's true? Or are we allowed to look into that and see if we can make a motion with a dollar amount, or is that something that's kind of outside of our realm?
Mr. Chair, I would recommend for the motion, shall the board desire to move forward to do the recommendation, because there, and then for Ms. Lopez, we could definitely work with them, and as our usual process, we would define an amount and then the metrics behind that. And then we could define the process on how that money would be channeled to workforce connections. If the board, I can double check with Christine, with our city clerk, but if the board sees this as an appropriate strategy to recommend, I would keep it as a recommendation, and then for the figures to be determined based on availability of funds, number of people that need to be served, and just have a bulk number worked out between staff and workforce connections.
Thank you for that. That's kind of the route that I was thinking as well. And then a really quick question, and then George, will get right to you, Mr. Miller. Just based off of what we were just talking about the number of displaced workers and looking at those, Ms. Lopez. So I know that COVID's really fluid. I don't know, do you actually have numbers of like how many jobs are not returnable that are displaced due to COVID right now? Or is that information still kind of coming in? Is there anything that you can actually pull from there? Because this is such a new kind of relevant but new situation that we're in.
I think that, you know, what we could do is, I know that they've been doing surveys at the state level and determining which employers have had to permanently close. And I think that we would be able to get a report like that. I think that other information, like what kinds of positions are kind of invalid now, or, you know, kind of been liquidated, if you will. That information is kind of still developing, but I think we could get some information about which employers in our area, at least for the region. I don't know if I can zoom in on just Doña Ana County, but at least for the region, we should be able to get some numbers on the employers that permanently closed.
Wonderful. Thank you so much. I appreciate that. Mr. Miller.
George Miller.
Mr. Miller, we can't hear you, sir.
Mute.
There we go.
Is that better?
Yes, sir.
Okay, great. Yeah, we don't want to leave anyone behind, so the number of displaced workers would be helpful. But my question is to maybe Ms. Lopez and Ms. Martinez. Does the city have in their economic development plan or the a direction that we want the city to go to as far as certain types of positions? Like we want to develop tech positions that we can start sometimes, I hate to say it, but the pandemic can be an opportunity to restructure the city to the way we want to go. And if money's going to be put to it, should we not be putting it toward the recommended, with priority toward the recommended types of jobs we're looking for? Does that make sense?
Mr. Chair? So we don't have specific occupations, Mr. Miller. However, in previous discussions with Ms. Lopez, actually we're discussing an additional partnership that we're defining. We want to make sure that these people that are being retrained, upskilled, that are actually able to get positions that are moving them towards self-sustainability, and also that it's something that it's in demand in the market. So we would definitely work with our partners, Workforce Connections being one, Doña Ana Community College, that they would be another one, to make sure that the training that they receive, it's for something that will translate into a job that would help them move forward. That's definitely part of the goal, and it's part of other possibilities that we're looking for. I appreciate that comment.
Yeah, and I think it's really, just to piggyback on that, you know, we want to make sure that it leads them to sustainable employment. But I hesitate to move in the direction of saying, okay, we want to do sector focuses, because that's what the board is doing, and that's why some people are not getting funded. So if we move in that same direction, we'll end up in the same boat where we can't serve basically the same people that are already being turned away because the eligibility criteria is just too steep. I think that, like I said, it would be case by case, and that if we can do a review on ONET where we determine growth in the industry that they may be interested in, and if it meets, you know, if there's at least a 5% growth in that industry in our area, then it's agreeable. And we just, you know, don't really limit it to a certain sector or anything like that. We just want to make sure that there's growth and there's a projection for opportunities and that there's jobs available to them or will be available to them upon completion of their credential. So I just wanted to add that.
Wonderful. Thank you for those great comments. Mrs. Thomas, you have your hand raised.
Yes, thank you. There are several lists of industries that we think are most likely to need workers, and so a lot of it is based on research that's been, so the Workforce Connection has a list, the Workforce Talent Collaborative has a list, the governor has a list, Mavita has a list, and I've put all those lists together and looked at which jobs go across all of those lists. So I'd be happy to provide that to everybody if you want to see that. So that they're based on a lot of research and working with industries, and so those are the areas that across all these different entities we think are the areas most likely to have jobs.
Thank you. If you'll forward that list to city staff so they can distribute it to us, that'd be great. But also with the same kind of like mindset of that, we don't want to, you know, turn away young or midlife entrepreneurs that want to get into a field and or a profession that they have an immense passion for. We don't want to turn those individuals away just because we have 271 restaurants in town. Why do we need one more? No, we want them to be able to live out their life dream, that they can employ more people. So also, like, I understand where we want to focus on certain things, but also we don't want to put entrepreneurs out that are looking at doing something that will definitely benefit and or create more jobs in Las Cruces. So I think there's a negative and a positive to both. But with that being said, we are at we're about 23 minutes out from having to conclude. So if there's any last minute groundbreaking discussion items on this before we kind of move on to the next part of the meeting, please do raise your hand so we can get those going. Okay, as I'm seeing none, and this was a discussion about actionable items that we wanted to talk about. I think we need as a board to figure out if this is a direction that we want to go, to talk about this, providing funding to people looking at up training and or getting into that. So I think we need to look at if this is something that we want to look at. And I see some hands being raised. Miss Debbie Moore.
Yes, Mr. Chair, I would just suggest that we continue looking at it. I just think there are some deliverables, some accountability, how the interaction would work before we get this into a recommendation. I'm totally for the conceptually. I'm just a little bit concerned about the actual deliverables in this regard. And of course, the legalities and the role of the city. So that would be just, I would like to have more presentation. Perhaps Tracy Bryan from the Bridge, who has done tremendous analysis on gap analysis in our various industries, et cetera, et cetera. I would just like to perhaps see some additional presentation in this regard.
Okay, I think that's definitely, thank you. I think that's definitely something that we need to look at. Even, I know that we said that we need to get with the community development, maybe get them on board and start having these discussions as well. Ms. Martinez, since your staff, if you have something to say to that.
Yes, Mr. Chair, just for clarification, the component of community development involvement would be to the portion of Ms. Moore's comment on fees. Everything else we could do through the Economic Development Department. What we could do is bring a proposal similar to what we did with the Las Cruces Safe Promise, with more of a structure behind what has been recommended. And that could give us more details of what this can be. For Ms. Moore, like I said before, since this is another governmental entity and they already have mechanisms to deliver those services, we can incorporate that as part of the proposal. And we've done similar MOU with NMSU, and this one was specific to help businesses through their business accelerator. So it's something that the city has done before, and we can replicate an MOU in that form. And we can definitely work with Ms. Lopez to give it some more form and come back to you with those details.
Yes, I'd like to maybe have a work session. I'm not sure who would want to be at that table, but to really dig into the meat of those key areas that we need to develop.
Wonderful, thank you. Ms. Sharon Thomas, you have your hand raised.
Yes, following up on what Debbie Moore said, I think we need to check on the legality. We really need to figure out if the anti-donation clause figures in here somewhere. I think we should do that first.
Okay, let's go ahead and take that to legal then and see what we can do on that. So I think we have some things that we want to get done before we make an actionable item out of this. So let's go ahead and move forward with the future conversation on this and get some more information before we make a decision on that. Moving on, because we are almost out of time. Ms. Martinez, yes?
Mr. Chair, just to be clear, would it be, in addition of us checking on the legality with our legal department, would the board be interested in a more robust proposal with the recommendation, or would that be for future meetings?
So I think if legal says yes, like go at it, I think then yeah, we're gonna want a more bulky presentation on this, so that way we can get our hands on it. So yes, I think that's step one, legal. Step two is bulking it up.
Thank you, Mr.
Okay, thank you. Okay, moving on, guys. So future discussion. Mr. Miller, I know that you have found someone that wants to and is able to present on the inclusive economic recovery framework that we've been talking about. And so I know that is something that we are going to get done. If you have anything to say on that or anything to share, but it will be on the next meeting, I believe. Yes. Okay. Okay. Yes. So we're going to definitely have two things on the next agenda, and that seems to be the inclusive economic recovery framework. And then we are going to go ahead and put the scholarship as a item on the agenda. And if it's legally acceptable and everything is good, then we're going to discuss it and talk about it and keep going. And if we come to the table and it is not legally acceptable to start looking at this, then we'll just do the inclusive economic recovery framework, and then we will go into future discussions. If anyone at this time has something that is worth saying that maybe we do need to put on the next agenda in addition to this, or if you think this is good, now's the time to talk about it. Mr. Harris.
This is Michael Harris for the record. One thing that was brought up last week when we did not have the meeting, at that city council work session, they had a presentation on inclusive economic recovery type stuff, community economic development. And there were a few items in there that the council specifically said, this should be on the forefront of X boards, and this board was on that list. And so we probably want to, if not for next meeting, keep it in mind for the one afterwards. So anyway, the items in that presentation, and I think Francisco sent it out, so everyone's already got that. A community land trust was one specific thing that was brought up as saying this should be on the forefront of this board. And other kinds of zoning and policy changes that might be useful to promote maybe different kinds of businesses or a different mix, going forward. And as we reopen, in some places don't open, or jobs are permanently displaced. I know that Debbie and Sharon were both in that meeting as well, so maybe they have some thoughts.
Yes, of course. Ms. Moore.
Of course, I have a thought. Debbie Moore, for the record. Thank you, Ms. Harris. Yes, that was a very, I just echoed what I have felt for years about the community development. And part of my requesting the policies from city staff, Mr. Harris, was because of that comment and how we can take existing or look at other perhaps potential policies in the future. And again, the community land trust, I think that is a really interesting concept. Again, where does that lie in the legalities of the city? But there were several interesting concepts that actually came out of that. And I highly recommend, if you haven't seen that discussion, that presentation, that everyone on this committee, do watch that. And Sharon and I have actually ordered books and we're reading his books, wonderful books. But that was my comment specifically, Ms. Harris. I wanted to follow up on those two things and I forgot to mention the community land trust. And the community land trust is the city would sort of own land, and then the other piece of that would be private donations to local investment in our businesses. So I think there are several things that we can start the ball rolling from the Economic Recovery Board as we send our recommendations through that in our plan moving forward. I mean, I think that is a really strong key area that we need to address moving forward. Thank you, Mr. Chair.
Thank you for that. Yeah, so fun fact, I actually took a class in college that focused on community land trusts back in St. Louis. So that is actually a really interesting, that would actually be really kind of cool to talk about. So maybe we can add that to a future discussion. That's actually a really kind of cool idea. Ms. Sharon Thomas, you do have your hand raised, ma'am.
Yeah, I just wanted to say that part of the discussion after that presentation by Mr. Schuman, especially from Councilor Vasquez, was, and it was something that Schuman brought up too, that, what should the council be doing? The first thing he said was to define economic development. We need to have an agreed upon definition of what it is and where we're going. So I think, I don't know if the council is going to take that up, but certainly could change our direction if we don't know exactly what the council sees as economic development going forward. So I think we should ask the council if they're going to do any more with that.
Thank you for that. Ms. Martinez.
Yes, Mr. Chair, board members. Actually, as a result from the presentation last Monday, Francisco and I had a follow-up with Mr. Schuman. One important item that I want to highlight is the elements that he spoke about, and actually during our conversation he mentioned, sorry for throwing all these ideas out as possibilities, and many of those items are longer term than reopening. So I would advise the members to rechannel some of these discussions through the board that is more long-term, which is the Economic Development Policy Review Committee. And so actually we will have a follow-up conversation with Mr. Schuman to see what elements would be actionable items that he could assist us with based on his experience, based on other information that he shared with us during that conversation. And if there is anything applicable for reopening specific, we would definitely bring it forward to the board if that's acceptable, Mr. Chair.
No, definitely. I think that's wonderful. Thank you for that. With that being said, everyone, we have 10 minutes to get off this phone call, and probably a little bit sooner since they need to check in and get everyone rolling on their end. So with that being said, we have 2 discussion items that is going to be talked about at the next meeting, and then we will go from there. And if, community land trust is really awesome and I could talk all day about it, but that is a thing that's going to take years to develop. So with that being said, if no other future discussions or no one else, has anything else to talk about today, I'm going to go ahead and call this meeting adjourned. And if you are able to tomorrow, tune in at 9 o'clock with the city council meeting where we will be going over the Las Cruces Safe Promise. So thank you everyone for coming on. And
Mr. Chair, I just wanted to remind everyone really quick, if you want to send the questions that you wanted to ask for tomorrow for the health portion, send them to me, and you can copy you, Mr. Chair, and Griselda and Cindy, and I can we can send those collectively.
I really do appreciate that. Thank you, Francisco. Have a great day, everyone, and have a good day at work. Bye-bye.
Thank you.